I wasn't able to walk from the car to the house. I wasn't able to walk up to the stairs to my apartment without being out of breath.
My knees started hurting, and they've been hurting for a long time, but even standing made them hurt.
I just want to feel good about myself again and be able to do the physical things I was able to do before.
I just said I'm just tired of struggling with weight. I've done it my whole life.
How did I come across it? How did I come across it?
Al Roker.
Just, I guess, hearing about it, you know, on TV, I guess.
After Al Roker had his surgery, you know, everybody then knew about it.
Well, I learned about gastric bypass surgery from my husband. Before we were married, when I met him, he had had it 7 months prior to my meeting him, and he was 475 pounds, and he lost 230 pounds. He had the Roux-en-Y surgery, and it changed his life.
One of the most difficult of the operations that has been undertaken has been the laparoscopic gastric bypass surgery. We attempted that operation based on having the capability of doing it and the fact that it was a challenge to us.
Yeah, I tell you, it's a scary thing to go through, but it's scarier to know the older you get, the more problems are going to come from being overweight. You know, and that's, I think, scarier, and what makes the surgery maybe a little bit easier, because the older we get, the more problems we're going to have because of the weight.
Along the way, we realized that it had great benefit to the patients who had the operation. Having their diabetes and their heart disease, their arthritis, their sleep apnea all resolve after the surgery has been a great eye-opener to each of us.
Obesity is just a broad diagnosis of multiple medical problems which occur when you're overweight.
As it stands now, my whole health is compromised. I can see myself dying at an early age. Hopefully, if I do lose a lot of weight, I can also go off or reduce a lot of the medication I'm on.
The laparoscopic procedure is based on 5 small puncture holes about the size of my finger, and the exact same physical changes to the gastrointestinal tract are created using a telescope with a camera and long instruments through those tubes.
A small pouch is created along the inner curve of the stomach, and a segment of the small intestine is attached to the pouch to allow food to bypass a portion of the intestine. This results in reduced calorie and nutrition absorption.
The discussion of obesity surgery can't be complete until there is discussion regarding the possible consequences of obesity surgery.
And specifically, a lot of people want to know how many people died from surgery. We lost a total of 6 patients from directly surgery-related complications of bypass, which, if calculated statistically, well below the national average of 1 in 200 deaths from the gastric bypass as reported.
It is a big undertaking from the surgical standpoint. The vast majority of our patients stay in the hospital 2 days and then go home, and then are followed up on a very strict regimen post-operatively. 1 week after surgery, 1 month, 3 months, 6 months, and a year after surgery. At each of those visits, we look for different benchmarks to be achieved. Dietary monitoring goes on afterwards. Specific laboratory information is checked for deficiencies in calcium, iron, B vitamins, and other materials which are specifically known to have occurrences in this population.
No, it looks good.
Yeah, like I said, I mean, that
you're
doesn't
very
look bad at all.
white skin, person. So
We attempt to get them into exercise programs and have services available both for their nutritional and their psychological well-being after the procedures in their adjustment to their new life.
now you're not in pain. You started to enjoy, you know, your new life.
Right.
So do exercise on a regular
I
basis.
seen a bicycle in the garbage the other day. I took it out of the garbage. I got
Whatever. you
pump
know.
the tires up and
Yes,
I'm gonna ride
please,
the bike.
please do. You can.
I have a ridiculous adulation for Dr. Apkin. You know what I mean? You do. You just do. When you've fought a battle your whole life, and I have since I can remember 10 years old.
I'm still the same person, but the way that people look at me is very different.
Maybe it's a little tough sometimes, you know, out with friends. You know, maybe they're eating something that used to be my favorite and now, you know, you can't have it. But you just weigh the options and you say, you know what, this is really not a big deal not to be able to have that rather than be what I was before.
You know, I mean, emotionally, I feel better. You know, because you look better. And when you look better, you feel better. You know, and that's been a plus. Everything's been a plus. Everything has been a plus.